A lot of talking, testing their memory, testing their ability to walk and get up and out of a chair, and plus or minus some lab work. So it's relatively simplistic physical exam kind of stuff, checking blood pressure and pulse and things like that. So you can do that. That's not what most clinicians do. Most clinicians will listen to your heart and lungs and check your ears and your eyes, or poke on your tummy and do a rectal exam and things like that. But technically, according to the annual wellness visit criteria set out by Medicare, you don't have to do that.
I got a question, maybe not appropriate.
Please, I like non-appropriate things.
I'm 82 years old,
Sir.
81, excuse me, and losing muscle,
Yeah,
but not losing strength.
yeah.
What is going on? Do you have any idea?
Well, I'm not sure what's going on.
My arms are shrinking, you know, and my legs, but my strength is there, you know. I walk on the golf course and everything,
Yeah,
but I just don't.
yeah. I'm not sure.
I'm not either.
I would be speculating.
Yeah,
Yeah.
and it's kind of alarming, but I mean, I feel well. But
Yeah. Are you losing weight?
no, I'm not losing weight, maintaining weight. You know, so.
So the metric there that would make me worried would be if you're losing weight. But if your endurance is good and your strength is good and you're not losing weight, I wouldn't be.
Yeah, there's nothing wrong with the exam, is there?
The appearance kind of bothers me.
Yes, I know that is.
Look at a baby suit on or something.
Bothers me too.
Oh, you probably have to do some,
How
wouldn't
much
you?
are you bench pressing now?
Well, I stretch every day. And I
Bench
would-
press.
Oh, bench press.
Bench press.
Oh.
You put maybe 250, put it up.
I curl and that kind of stuff.
What do you curl?
6 ounces.
No, that's what I curl, 12 ounces. 60 pounds, you're curling 60 pounds? All right.
Sounds okay to me.
I'll ask you the same question I asked my primary care physician. I told him that we had an annual, at least, opportunity to talk about prostate cancer, seminars, whatever you want to call them. The last one in March was at Fred Hutch, and the introductory remarks included a comment from the lead saying we don't talk about marijuana or any CBD oil or anything in this conference. He laughed because the rest of the remarks were, talk to your primary care physician. How do you school yourself about marijuana? And some of the questions we might have about using CBD oil and the fact that it doesn't seem to be regulated in any way. When does it go bad? What's the shelf life? It's not on there in any way. And he reiterated what I just said about there is no control. It wasn't much in the way of an informative session because he didn't have answers for me except that. It's not regulated. You can't tell you what is or isn't bad. You can't tell you how long the shelf life is. How do you train yourself to answer the kind of questions?
There is no answer right now.
No.
We have no data. For the last 100 years, you know, we've been unable to study THC or CBD products based on the federal government. My DEA license is still from the federal government. So and everybody makes it differently. It's basically a nutritional supplement, like, you know, some of these special vitamins or something for prostate cancer. It's completely unregulated. There's no data as to what's really in the CBD or THC that you're buying at the store. So I think you're making it up as you go. That doesn't mean that it's not effective for your symptoms or that it's not safe or that it's not unsafe. It just means, honestly, we don't know. And there is, because there's no real data, there's a couple of sites now that are making marijuana in a pharmaceutical grade with pharmaceutical kind of built-in safety thing and trying to do some research. But it's extremely expensive. And I think the biggest one's down outside of San Francisco, and Stanford's doing some research on that to try to get some baseline data. But you know, you're dealing with a drug that's been around for 5,000 years at least, and we don't know anything much about it except what somebody at the pot store is telling you, which may be an 18-year-old kid. You know, your expertise is going to be better than mine, and your experience of your own body is going to be the true experience. There is no doubt.
Truly, ignorance is not bliss.
Well, it can be, and it can be really not this. So I mean, but I'm not trying to be difficult. I'm just saying there is no doubt. And somebody who says, "Oh, this drug is going to help you," is like going to GMC and saying this vitamin is going to help you. There's basically no doubt. You know, or the data is 30 studies. You know, it's the data on the 30 patients who took ginseng and thought they had better, improvement in mild depression. And it was 30 patients, 20 years ago. That's not pretty bad.
I'm my own best advocate.
You're your own best advocate, and you do your own research, and you figure out when it goes bad and when it doesn't go bad. And I believe you.
When it turns color, don't use it anymore.
Yeah, right. When it smells bad.
And I have a second question for you.
Please.
As far as your site interests are concerned, I'm very interested, as we all are at my age, about cognitive impairment.
Right.
I'd like to hear your thoughts about how we can improve our odds about putting off dementia. I've read some studies that indicate body mass,
So I think this,
overweight is possibly something we should concentrate on.
the most important thing, I think, with putting off dementia is what I said at the beginning, is it's the heart. Most of the people who have significant and rapidly progressive dementia also have a vascular component. So
vascular.
often they have multi-infarct dementia, they've got little strokes, other things going on. So my first thing would be control blood pressure, stop smoking, exercise, control cholesterol if there's reason to control the cholesterol. Do the things that help to prevent heart attacks and strokes. Because in people who have rapidly progressive dementia, often there's a second component besides just Alzheimer's disease or Lewy body dementia or something else. So that'd be my first thought. I think your issue on keeping physically fit and weight as close to ideal body weight as possible has been shown not so much with dementia, but with doing well into maturity. When we look at the societies that have physically active, vibrant elders, they tend to be very, physically fit. Not that they're going to the gym and pumping 60 pounds or 260 pounds, but that they walk. They walk. They go. They don't take the car. They walk. They park. These are the folks that are physically active, and they're socially active. So I think physically active, socially active, an appropriate weight, control vascular risk factors.
Best thing is to write with
That's
the
where I
left
think
hand.
the
That'll
biggest
cure
data
you.
is for preventing dementia.
Well, it's bad
Not
enough I
necessarily
can't read it
bad.
now. Oh.
Mental attitude, the idea that there's a lot of good things rather than there's a lot of bad things.
Well, and I think that goes true of everything.
I do, I think that.
Treatment of depression or anxiety, when we look at any chronic disease, that helps. And so if you've got social support and a positive outlook, and it certainly is true in prostate cancer, certainly is true in heart disease, certainly is true in other cancers. I think that's true.
I get evaluated by my 3 daughters every once in a while.
That's it.
I get evaluated by my 3 kids too. Yeah. Sir.
Is there such a thing as a Medicare doctor?
There may be. I don't know what that would mean. From my standpoint, there are some doctors that don't accept Medicare.
That's what I was kind of getting at, because if they have Medicare doctors, they can pay the Medicare doctors what they want to get paid, and then you wouldn't have to lower your standards to take less pay.
Well, I wouldn't worry about it. There's no doctor that's starving out there right now, probably. I think we're all doing fine. I wouldn't worry about that. But I think there are doctors who say Medicare doesn't compensate enough, and so I'm not going to take Medicare patients. That's not what I do, and that's not what anyone in multi-care does. So that's not.
It's usually community health that has all the Medicare doctors.
Yes, Dr. Kramp, what is your opinion on ultrasound screening packages that you see on TV now and then?
Oh, for like the
The carotid
vascular
artery
disease and the renal arteries.
bone
and stuff.
density,
Oh, yeah, that's a good question.
the calcified arteries, whatever.
I tell my patients, I think that is reasonable once. If you're going to do that, do it early on, because you you can see stuff with critical carotid disease that might affect how we treat your cholesterol, you know, or how aggressive we are with blood pressure. We might see something that we would do something with. I probably wouldn't do it again.
Yeah, I had one done about maybe 30 years ago here in the Tacoma area. Never had it done again because it wasn't that conclusive.
Right.
They didn't do anything.
Right, right.
Showed a little bit of calcification.
I mean, I think it's reasonable once, about 100, 150 bucks now.
That's right,
Right.
180.
I get a reminder 4 times a month, so that's 48 times a year.
I don't know that I do it more than once. Because if you find something on the once, then it's no longer screening, and then your doctor's gonna be doing it. But some of those tests as screening tests are not covered by Medicare, and so you would end up paying a lot of money out of pocket. But once it's identified, it's no longer a screening test, and then you're following up carotid artery disease, or renal artery disease, or an aortic aneurysm. Medicare does pay once for an aortic aneurysm screening in men if you have high blood pressure. So that's
Can I follow up on your last comment on high blood pressure? Why do I have, it's me and a lot of other folks as well, have what they call white coat syndrome. I'll go to my doctor, and my blood pressure will be 190 over 100 or something like that. And I come home and use my own, it's down to 130 over 62.
Yeah.
I suppose they need
Yeah, I don't know that there's an answer to that. What I can tell you is people who have white coat hypertension are at higher risk for vascular disease. So if you can walk into a room and sit down for 5 minutes and have a blood pressure of 190 over 100, that's abnormal. You know, so that's high blood pressure. And the idea that this is just doctor stress, it's like...
The potential is there. I mean,
Yeah,
you got that.
that's, if you're getting stressed walking into a room and sitting down for 5 minutes, you're getting stressed in other situations like that. That would be that's my take on it with my patients. It's like, yeah,
Thank you.
yeah. Please.
Me?
Yes.
Okay. If a person has cancer, doesn't that show up in their blood test? Their red blood count, their white blood count?
Wow. No.
No.
No. Typically not. Now, there are some cancers where that will show up. So if you have leukemia, for instance,
Yeah.
that'll show up. If you have polycythemia, which is a bone marrow type of cancer, kind of like cancer, that can show up. But most cancers, in and of themselves, especially early on, will not show up in a blood count typically. So they may have a mild anemia, the platelet count may be a little low, you know, a little bit off, but you're not going to sit there and go, oh, that person got cancer. That's not going to happen.
Yeah, it's just
So
basically blood.
when does the white count lower and the red, and that happen? I thought that was when infection or disease was going on in your body.
Many things can cause a white count to go up, including some medicines,
Oh, yeah.
including stress, including infection, including leukemia. Many things can cause red count to go down.
I don't think so.
Including, obviously blood loss,
Yeah.
if you're bleeding somewhere. If you have kidney
Chocolate milk
disease,
doesn't.
often the blood
No, it
count will go
wouldn't.
down because you're not making the hormones in your kidneys that help your blood make red blood cells. Or if you're iron deficient or B12 deficient or folate, I mean, it's a lot. A lot of things can do that.
Right.
Yeah.
I just thought it was automatic if your body's fighting disease, and isn't cancer considered a disease?
If your body is fighting disease, you may become anemic. And that's the disease, the anemia of chronic disease or chronic inflammation. But that can be with sarcoid, that can be with cancer, that can be with rheumatoid arthritis, that can be with all kinds of diseases. So it's not like this, then that. It's just not that.
What is this thing he was talking about, white what?
White coat hypertension,
Yeah.
that's when you go to see your doctor, your
white
blood
coat.
count. Yeah.
Oh, I didn't understand the word he said. Okay.
That's one of the reasons I don't wear a white coat typically.
Well, it's usually for people that, usually for
Don't wear white coat, you'll have.
people didn't have a pleasant surgery recovery, like they might have been in ICU for 3 or 4 days.
Yeah.
I was a little bit pretentious for about a year after they removed my kidney.
Yeah.
So, but then I realized it's all in my subconscious.
Well, it has a lot
Recognize
to
the
do.
fear and do it anyway. And that will negate some of that white coat
Yeah.
or white
No.
medical.
Yeah, teaching people to meditate
Yeah,
often
sure.
will help lower their blood pressure.
Right, because
Please.
When it comes to the blood pressure, what are you looking for as far as dealing with hypertension. There's numerous drugs. What flips you over to start prescribing?
Well, that's a big question. So if somebody has no known heart disease, no known diabetes, and has 3 elevated blood pressures over 140 over 90, despite trying to work on exercise, weight loss, and alcohol cessation, then I'll start them. If they've got known heart disease or diabetes, I'm starting them on the first time.
That makes sense.
Because I got no reason not to. So it kind of depends on the whole story.
And what determines whether you go for the working on blood volume versus the restricting of the artery?
I'm not sure.
The ACE inhibitors versus the
Beta blockers versus the hydrochlorothiazide,
Yeah, right.
calcium channel blocker. All of those medicines have various places where they fit, depending on what other disease processes the patient has. So, for instance, if somebody has heart disease, you may use a beta blocker because you die less with a beta blocker if you have heart disease. If you've got diabetes, you're going to probably use an ACE inhibitor because that helps protect the kidneys in diabetics more than other medicines do. If somebody's fluid overloaded, you may use a diuretic for fluid agent. Somebody has AFib, you're going to use something to slow down their heart rate at the same time, calcium channel blocker. It depends. If you're saying if everybody's the same, what would you use? Typically an ACE inhibitor, because it's cheap, it's pretty well tolerated, it helps protect the kidneys and the heart, and it's easy, it's once a day. So typically an ACE inhibitor, everything else is equal. But everything else usually is equal. You know, does that help?
yeah.
But it's
So I was curious of what decided in one pill versus another.
and just like the PSA, the recommendations for the first line blood pressure interventions and when to intervene and stuff are constantly in flux. And so they get together and do this joint recommendation. JCHO does this thing, and so it's always, they keep changing. Yeah. Sir?
Doctor, what's your recommendations on vitamins, minerals, and things like that?
If you live in the Northwest,
Yes.
you should be on vitamin D.
Okay.
Right.
D3,
How about all these other wonderful vitamins?
they told me not to take it with radiation.
So again, you're getting an allopathic physician's point of view.
Okay,
If you live in the Northwest, you should be on vitamin D.
fine.
Period. If you're on a proton pump inhibitor like omeprazole chronically,
Vitamin D3, man.
you should be on B12.
Oh, this is bad.
Otherwise, I don't find a whole lot of data to support multiple vitamins. I think they can say whatever they want because they're not regulated. So the marketing is just marketing. So unless there's a reason for you to be on another vitamin, like you've got macular degeneration and you're on the eye vitamins or something, I'm hesitant about spending money on other vitamins.
But D is good.
D is good because you live here.
Yeah.
Does it
Sunshine.
absorb into your body pretty well, or do you have to have sunshine?
Well, sunshine helps to make it active, but you can absorb it pretty well as
As a
It's vitamin.
tablet or whatever? Oh, thank
yeah,
you.
yeah.
What's the difference between D and D3?
So
What's the difference between vitamin D and D3? I take D3 about 2,000
perfect. That's perfect.
milligrams.
They sell it at Costco.
Great deal.
Yeah.
You can get 1,000, 2,000, 5,000.
There you go.
They're all good. If you take 5,000, probably once or twice a week's plenty.
And that, answer that. In other words, 5,000 is every day or something like that?
No, you don't
5,000
need
is
that
probably more
much.
than you need every day.
Good God.
You know, if you take 1,000 a day, that's more than the recommendation of the USDA. But if you live here, I take 1,000 units a day or 5,000 units once or twice a week, something like that.
Can you take too much?
Yes, you can. You can get vitamin D toxic. Got to work at it, but you can.
Yeah. Then how do you know at that point?
I test you. You tell your doctor you're taking 6,000 milligrams of vitamin D every day, and I'll check you.
Along the same lines,
I'm
what
gonna
about,
say, excuse me, on that deal, now we're talking about PSA, you gotta talk to, get PSA, is it vitamin D, another one of these that you need to tell your doctor?
I think that if you're taking any vitamin regularly, regardless of what it is, or marijuana or CBD or whatever, I would encourage you to tell your doctor that you're taking every vitamin. Because some vitamins are completely safe, you can take gobs of them and you'll just pee it out. Vitamin B12, take all the B12 you want. I don't think you can get toxic, you just pee it out.
Okay.
You store 5 years of B12 in your body, so it takes a while to lose your B12. But there are some, like vitamin A, which we use for our eyes a lot.
Right.
So, well, take that, it's good for your eye. You take too much vitamin A, you can get sick. It can cause liver disease.
Change color too.
So, yeah, that's keratin. Yeah. So, I think it's good to let people know if you're using them.
yeah, what's your opinion of over-the-counter pain medication, especially, what is it, NSAIDs? I take occasionally, I don't take it often, naproxen.
Yeah.
And there's a debate about too much of that will cause organs to
Sure it will.
become affected.
Well, there's not a debate about, so first of all, the safest over-the-counter pain medicine you can use, by far, in my opinion, is Tylenol.
Yeah, that's my.
So Tylenol up to 3,000 milligrams a day is almost always safe. Even in people with cirrhosis, people who have liver failure, using Tylenol is still our first line pain medication.
My wife has that, and they said no Tylenol.
Yep, I would argue that if she has uncontrolled pain, the safest drug for her is still Tylenol, in my opinion. Now, again, I don't count, I'm not her doctor, but in my opinion, that's, and when we talk to the people who do liver transplants for cirrhosis, they agree with me. So, now you wouldn't use 3,000 milligrams in cirrhosis, but even low-dose Tylenol would be reasonable. But you'd have to clear that with your doctor. Everything I just said, just not about that.
Well, they said that
And then
50
the NSAIDs, for people over the age of 70 or people who have renal dysfunction, NSAIDs are certainly at higher risk. They damage kidneys, and they cause bleeding in the stomach and bleeding in the bowel, and they are one of the most common drug-related ER visits is for GI bleeding from NSAIDs and things like that. So, yep, I think you're right. Tylenol's safer. NSAIDs, while they can be very effective and very useful, we try to limit them, especially as we mature.
Which one?
So that's naproxen, ibuprofen, Aleve,
Yeah.
all that stuff.
Aren't they anti-inflammatory?
They are, yes, sir.
And some of them do a very good job, I'll
They're
attest.
great drugs. And just like so many great drugs, they have a double-edged sword.
Oh.
Yeah.
How about sporadic use? Like if I wanted to take it 3 or 4 times a month, do I really worry about it?
Well, again, I don't know everything else about you,
Yeah.
but if your renal function's pretty good,
There they are.
and you don't bleed in your stomach, and you haven't had a history of ulcers, I think that's reasonable. Yeah, yeah, sir.
What's your opinion on 81 milligram baby aspirin?
It's a great question, because that's really been a place of, we've had a lot of concerns about what to do there, and again, kind of like we talked about, I don't know what I broke here. Broke some. With, we're getting all these various recommendations and what to do with them. What we've known for years is that if you have a heart attack, if you have a myocardial infarction, you're having a heart attack right now. If you're on aspirin, your absolute risk of dying from that heart attack goes down by an absolute value of 3%. So if you have a heart attack right here, your risk of dying is 17%. If you're on aspirin, your risk of dying goes to 14%. It's about a 20% risk reduction.
What about,
So that's good. But your risk of having a bleed from the aspirin also is higher when you're on aspirin. So the answer to your question is, if you're a smoker who has diabetes and high blood pressure, I want you on aspirin. Because your risk of having a heart attack goes up.
I got high blood pressure and I quit smoking, and my doctor recommended the 81 milligram.
I think that's reasonable if your doctor said, yep, let's stay on the 81. Yeah, I think that's reasonable. If you're the vegetarian, never smoked, normal blood pressure of 110/60 forever, race walking,
Oh.
lacto-vegetarian, then maybe aspirin probably isn't worth it to you, because the risk of a GI bleed is probably higher.
I heard that if you think you're having a heart attack, actually experiencing a heart attack, if you take an aspirin, that might help reduce the chances of.
That's correct.
It'll give you more time to the doctor.
You chew the aspirin to get it activated as much as possible. You chew the aspirin first thing if you think you're having a heart attack, and that does, because of what I just said, that immediately starts to work on the platelets, and your absolute risk of having death from that heart attack goes down. Yeah.
So I could market something with a little aspirin, a little pouch, like when we were teenagers, we used to go to the gas station, put a quarter in the machine. Well, now that you're 70, go in the same machine, put a quarter and get some aspirin.
You let me know if that works, because I want a piece of that, okay?
What was that figure you used for normal blood pressure, 110 over?
Well,
He just made
so
it
a
up.
normal blood pressure, normal, kind of what we're looking for is between 110 to 120 over 70 range, 60 to 70. That's kind of the ideal, perfect, blissful range.
Okay.
140 over 90 is where we kind of say, yeah, we've got to start drugs.
Got it.
Which is more dangerous, the higher or the lower number, or both do?
Yeah, both.
Well, they're both bad.
Yeah.
They got a
You wanna blow.
formula for temperature. There's an average temperature for a woman is different than an average temperature for a man.
98.6.
Somebody says 37.5 is for a man and 80 is for a woman. So I don't know, is that a true thing?
I don't know. I haven't heard that, but I mean, we do know that women, as they're cycling, their temperature changes just with their cycles.
Wow.
So women, their temperature tends to go up and
Yeah, it has
down
to vary.
normally
He's not talking about
in the premenopausal state.
No,
So
There's some program on TV that says that.
talking
the
about
normal
time, period of time.
the new normal,
could have been on
Why just put it in there?
60
What do you mean?
I don't know. All
Okay,
right.
let's wrap it up. Any others?
Thank you all very much.
Yes.